Take two, everyone. Let's see how we go this time. I think the technology is now on our side. So let's go back to the beginning. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, author of A Life, a Finger, a Pee Up a Nose, a practical guide to baby and child first aid, and also founder of CPR Kids. And at CPR Kids, what we do is we empower families and parents with the life-saving skills of both baby and child first aid and recognition of the sick child, which is so important. Now, what I'm going to get you to do is if you can give me a thumbs up or a wave, if you can hear me, that would be fantastic, just to make sure that on this second time round that we make sure that all the technology is doing as it should. I suspect this time that we're okay, but I would absolutely love it if you can type in the comments or give me some thumbs up if all is good. Great. I'm seeing some thumbs up and things here. Fantastic. Thank you very, very much. Now, as I started saying before, today's Facebook Live session is on red flags. And what do I mean by that? What I mean is, what are those really concerning signs and symptoms when your child is sick that indicate that you really need to seek urgent medical help? Now, of course, there are lots of different things. You know, if a child is bitten by a funnel web spider, you know, of course, that's urgent medical help. If your child has, you know, burned themselves, they've got extensive burns, of course, that's immediate medical help. We tend to know these cut and dried things about when, you know, an ambulance needs to be called. However, especially in little ones, there are some signs and symptoms. And, you know, when kids get sick, what can often happen is they just rumble along and they just become generally unwell. Often you need to trust your gut about what is actually happening. And, you know, sometimes, you know, my background is that I, for my entire career, have been a paediatric emergency nurse. And for the number of times I've had a parent come in with a little baby or, you know, a young child and say, they're just not right. They're not themselves. Something is just, they're not right, and I'm really worried. And they trust their gut instinct. And that's really, really important that you do that you really do listen to your instinct, because you know your child better than anyone else. You do. You absolutely do. But there are certain signs and symptoms which we're going to go through now, which mean, you know what, it's one of those things that just confirm, yep, I really need to seek medical help. So let's get into it. First one. Now, this is rather an obvious one, and the others probably aren't so obvious, but this is probably the most obvious one. If your child has any difficulty breathing, so if you notice abnormal breathing on them, so what you might see, and we've done a whole Facebook Live on this, on simply what to look for if they're having difficulty breathing, and that is on our YouTube channel, CPR Kids TV. So make sure we'll put a link in the comments below so that you can jump on over and watch that entire thing, because I'll just give you a quick little overview now. But if your child is breathing faster than normal, if your baby is, you know, you notice that their nasal is, that they're trying to get my words out, that their nostrils are flaring, that their head bobbing, you know, their head's going up and down trying to get this breath in. They're sucking in around under here. Their tummy is seesawing up and down. They're sucking in around here. So if they are having difficulty breathing, of course, this is a huge red flag. It doesn't matter what the cause is, because often we can think, oh, babies only have difficulty breathing when they've got a cold or they've got something respiratory. But you know what? That's not true. Other things can be wrong with your child, such as, for example, sepsis. Sepsis is an infection in the blood. Just a simple way of explaining that. There's a lot more detail to it, but, you know, we've got limited time today. And one of the signs and symptoms there can be that your baby is breathing faster than normal and their heart is beating faster than normal. So there's some of the things that it's not just, you know, the cause of an infection in their lungs or something that can make them breathe faster. So abnormal breathing is your first red flag. Now, what about your second red flag? If, particularly this applies to babies as well, if they're not feeding properly. Now, one of the first things that you may notice when your child or your baby becomes unwell is that they are refusing or just not wanting to have their feed. So breastfeed, bottle feed, whatever, that they're not doing that. And we need to remember that babies in particular, they don't have much reserves. They can get dehydrated very, very quickly. So it can be really concerning if your baby is taking, for example, less than half their normal feeds. But even if their feeding is dropped off, that's something for you to go, oh, hang on a sec. This is not normal. What's going on? And it may be that just for a couple of feeds, they didn't feed as much and then it's back to normal again. But if it is consistent, if it drops off quickly, if they're refusing to feed, that is a red flag. Another one, and just going back for a sec, the causes of this, they may be having difficulty breathing, which stops them feeding. They may be just, they may be generally unwell. There's a million reasons why. You don't need to diagnose why. It's just one of those red flags that says, hang on a sec, my baby's not feeding properly. There might be something else going on here. Next, your baby is not having as many wet nappies as usual, or your child just isn't weeing as much as they normally do. So abnormal breathing, or, basically not breathing properly, distressed breathing, they're not feeding properly, they're not weeing as much as they normally do. So less wet nappies than normal, they're just, they're decreased feeds, they're not producing enough urine. This is concerning as well. So certainly those things together, we're going, oh, hang on a sec. I might not know what's wrong with my baby, but they are alerts. They are the red flags that there is something wrong. What else? So we've done the abnormal breathing, we've done the reduced feeding, we've done the reduced urine output or less wet nappies than normal. Also, what's their alertness like? Are they floppy in your arms? That is a huge red flag. That child that you're having difficulty rousing, that is really, really worrying. That is 000, okay? If you're in another country watching this, we are calling an ambulance for that child who is floppy in your arms. That is really, really worrying. We're trying to rouse them, but they're just not. Your child might be lethargic. They are drowsy when it's not their normal sleep time. Once again, that is another red flag. Okay, so what have we done so far? The abnormal or distressed breathing, reduced feeding, reduced wet nappies, that floppy, lethargic child. So these are all things that really do worry me a lot. So what else is there? Now, this one, and I find this a little bit tricky to talk about, that often what will be included here is if they have a fever alongside a rash. So, and when we talk about the rash, we talk about a rash that when you press on it, that it doesn't go away. So it's called non-blanching. And, you can put a glass over the top of it and the rash, you can still see it. It stays there, rather than often when you press on a rash, it will turn white and then it will go back to pink again. So this type of rash, which can be called petechiae or purpura, it can be multiple different causes, but one of them can be meningococcal. And so that is one of the things that is also a red flag. However, this is the caveat here. Often a child will show these other symptoms first before the rash arrives. You will have, more often than not, and remember there's always exceptions to the rule, you'll have that lethargic, sick child with a decreased feeding, all that kind of stuff, before you tend to get to that rash. So you will recognize these other signs and symptoms first before then. So that's an important thing. But, that is still a red flag that is very, very concerning. So what else is there? Let's recap again. And the reason I keep saying this over and over again is because I want to help you remember it. So that child with difficulty breathing or faster breathing, the child who has got less wet nappies than usual, who is not feeding well, who is floppy and lethargic. They may have a fever accompanied by a rash that when you press on it, it doesn't go away. But in saying that, your child can still, particularly a baby, because babies can't regulate their temperature very well, especially the newborns, they may not have a temperature, a fever, okay? They may not. This does not mean that they are not very, very sick, and that's important. The one exception to the rule, of course, is little babies under the age of 3 months. If they have a fever measured under the arm with, a thermometer that is above 38 degrees, that is a red flag. You need immediate medical help because little babies don't have the immune system. So the next red flag, under the age of 3 months, if they have a measured temperature above 38 degrees, that is a ticket to the hospital, okay? Now, otherwise, we're not so worried about the fever. We are looking at your child, not the number. We are looking at what your child looks like, and that's really important, okay? So, exception to the rule, that under the 3 months. And there is another red flag, and that is your child's colour. What do they look like? Now, and this is an important thing to remember, is a change from their normal skin color. Your child could have pale skin, they could have very dark skin. It doesn't matter what they are normally, it is about the change and what they may look like. If they are blue, if their lips are blue, around their lips, their face, their torso, their nail beds, if they are changing colour blue, that is a medical emergency. The other thing that you may notice is your child may become what we call mottled. Now, I apologise to all the vegetarians out there, but this is a really good way of describing what being mottled looks like. So when you go to the butcher and you see all of those beautiful fat Italian sausages that look really kind of marbled, they've got, the fat and the meat through them, that is what mottled looks like. So, sometimes when you go outside on a cold day and you look all kind of splotchy and, that's what I'm talking about. A child who is mottled and they are not normally like that, kids are born like that, they just normally look mottled, that is also concerning. So it's about, is this normal for your child or is it not normal for your child? And that's important. And the biggest red flag of all is your gut instinct. If your gut says that there is something very wrong with your child, you are probably right, because you know your child better than anyone. Please, 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 please trust that gut instinct and seek medical help. Okay, so let's go through these flags for the last time. I know I've repeated myself a lot. It's been deliberate. I want you to not worry about this. Remember this, because I'm tripping over my words here. So, number one, if your child is having difficulty breathing, that's a red flag. If your child is having, they're just not wanting to feed or less feeds than usual, they have less wet nappies, or they're going, passing urine less than normal. Okay, there are big red flags, yeah? What else? Is your child floppy, lethargic, not responding properly? Big red flag, definitely. If your child has a fever accompanied by a rash that when you press on it, it doesn't go away, big red flag. But remember, I said you're likely to see a very sick child before that rash appears. Don't wait for that, okay? Really, really important. A child who's had a colour change different to what their normal colour is, so they're blue, they're mottled, that is also really, really concerning. And most of all, your gut instinct, okay? That is one of the most important things ever, is trust your gut. If you feel there is something wrong, please, please, please seek medical advice. Whether you're on the phone to the medical advice lines, whether you're calling 000 if your child is seriously unwell, just trust your gut, okay? It's an important, important, important thing to do. Now, what I would love from you, that's really, really important, is take the time now to enroll in a baby and child first aid class. Now, I know that, I harp on about this all the time, but you need to know what to do in an emergency to help your child, whether it's for them choking, whether it's CPR, whether it's how to manage burns, whether it's recognition of a sick child. You need to know what to do. Please just don't put it off any longer, because I know that what you do in those minutes before an ambulance arrives will impact on the outcome of your child. Jump on our website, book into a class. We've got them everywhere. If we don't have one near you, we'll help you find another provider that is near you, because you know what? It's just about making sure that every parent and family has these life-saving skills. It is so, so, so important. And remember, we've got an online course now for those who can't get to a course in your area. Please go and do it. It's really, really important. And the other thing that I'd like you to do is go into the comments below and please tell us what you would like us to talk about next on our Facebook Lives. We do this for you. We want you to have the best up-to-date information. So please jump on, go ahead, tell us what you want, and we can give it to you. Okay. We'll see you later, everyone. Actually, I'm being very naughty here. I forgot to ask. Does anybody have any questions? Please feel free to type them in the comments now. Are there any questions at all? Please go ahead and jump in there. Put them on there. Now, remember, I will actually put the resource to our Facebook Live as well in the comments below. That's on our YouTube channel, so that you can watch that about what to look for breathing difficulties. Okay, so it doesn't look like we have any questions, so I'm going to say goodbye. Thank you for joining us today, and we will see you again soon. Okay, bye everyone.